Good afternoon, everybody. If I could grab your attention, I would like to firstly, I'll welcome you, do some formalities in a minute, but I'd like to introduce you to Perry Wandon of the Wurundjeri people to come and do our Welcome to Country. Thank you very much, Perry. So thank you very much, Perry, and I'm sure you'll agree it was a very personal and heartfelt welcome to country, and I would also like to acknowledge the traditional custodians of country, particularly the Wurundjeri people of the land that we're on today, of the Kulin Nation, and pass on my respects to elders past, present and emerging. So good afternoon and welcome to the 28th Annual Dental Health Services General Meeting. My name is David Stevenson and I'm very proud and very privileged to be the chair of DHSV. I'm delighted to see so many of you here today. It's been 3 years since we've had an in-person AGM, and we've certainly missed that face-to-face contact which we all crave. You can see many of our wonderful staff here. I can see many great partners from the department. We see lots of great people from our Community Advisory Committee that we're going to talk through a little later on with Sandra and Billy. But we're thrilled to have you all here, so thank you for making an effort, and also thank you very much for the people who are watching online. We appreciate your engagement as well. So this meeting is open to the public. An advertisement was placed in The Age on the 16th of January, advertising as such. And we also advise people through the DHSV social media channels. We're on Facebook, Instagram, Twitter, LinkedIn. Now we're not on TikTok as yet, but Sue has confirmed that the executive team are doing some dance moves, so we'll look forward to seeing that for next year. But we at DHSV believe that the only way that we can provide great care for our consumers is to listen to them, is to talk to them, is to understand them. And so therefore, consistent with that consumer first approach, I'd like to introduce you to our consumer superstar, Sandra Anderson, who's going to share her perspective on being a CAC member for the last 10 years. Now, before she gets up, a little bit of an overview on Sandra. So it's been 10 years since Sandra first saw an ad in the paper about DHSV advertising for a Community Advisory Committee advertisement. And so in that 10 years, she's already made a fantastic contribution. She's brought her children, her grandchildren here to be treated. And she really wanted to share her perspective of what it's like to be a patient at DHSV. And over those years, she's joined the Safety and Quality Committee already. She's been a consumer representative on the National Dental Directors Group. She's also helped us in our value-based models of care, which you'll hear a little bit more later on. She loves finding out what matters to patients. And I love this quote, that the world would be a far better place if we listened more and judged less. Another wise words, Sandra. So please join me in welcoming Sandra, and our CEO, Sue McKee, is going to do a little bit of a conversation with Sandra about what it's like being a Consumer Advisory Committee member at Dental Health Services. So welcome along. Thank you very much, Sandra.
So welcome, Sandra.
Thanks, Sue.
Big deep breath.
I had a speech all written out and she told me I'm not allowed to use it. So.
That's a bit of an exaggeration. What I actually said to Sandra is that she will undersell herself and her contribution to this organisation. So perhaps a Q&A would draw out a bit more exactly what I said. But anyway, welcome and thanks so much for coming. So can you tell me or tell us, what have you and the CAC members been up to over the last 12 months?
Over the last 12 months, we continued on regardless of COVID. We did it via Zoom. It was something that, when you think about it, a few years ago, we worried about how we were going to get on our Consumer Advisory Committee from distant places, from the country, from that sort of thing. And all of a sudden, COVID hit us, and all of a sudden, everyone realised that we could do it via Zoom or via Teams on things like that. So it was something that we continued on regardless. Some of the other things that we've been doing, two of our CAC members are now co-chairs of other committees. Kevin Morris is actually the co-chair, first time ever, of our CAC, and I'm the co-chair of Partnering with Consumers Group. And a lot of other committee consumer group members are co-chairs of their subcommittees as well, which is a first for a lot of people because it gave everybody a little bit more action, a little bit more things to do, and have their voices heard as well on other committees as well.
Gave a few people a little bit of heart palpitations as well when we actually entered into that idea, but it's actually really raised the voice of consumers across a lot of our committees. Some of the other things that the committee have been up to, so we've had a very, very big action plan for the year. So some of the things in relation to the engagement that the teams have been, or the members have been working with. I know Billy's here today and he's been in and out of
He's going to talk about that, I suppose.
He's been in and out of the organisation helping us with developing different parts of the work that we've been doing, particularly around value-based healthcare and how we engage our consumers in that space.
And I think that's where the Consumer Advisory Committee sort of helped with the development of the value-based healthcare, because it wasn't just dollars anymore. It wasn't just people coming through as a number. Every person was heard. Every person was an identity, whether it be that person or their carer or their family member or things like that, because we had to go through all those sort of issues where some of the people came through couldn't speak English. They came in as a family, so that as a close-knit family, and that's the way they generate, the way they work. So that was another way of going through the value-based healthcare.
Yeah.
And the awards that we won through.
Yeah, of course, and the awards. We'll talk about those later. The CAC, as one of the CAC members, we went through accreditation last year, and I know that you were interviewed. What was that about? What were they asking you, and what was I guess the input into that process?
I suppose I was fortunate enough to be asked as a CAC member to be assessed by the assessors, and they actually asked us what did we feel as consumers that we were getting out of the committee meetings. And I was honest and sort of said the fact that, we're there to ask questions if we need to, if there's things that need changing. And it could be as simple as a form that they might be sending out to somebody. We've got the tick with it as well, but if a form's seems too clinical, then it's up to us to sort of look at it and go, no, make it more simple, understandable, make it in different languages, make the font a little bit bigger, that sort of thing.
I know that the team worked heavily on our texting program. So when we're texting out an invitation for people to commence care and actually participate in our oral health questionnaire, I know the CAC were heavily involved in designing and redesigning and testing that to make sure that it is consumer friendly and it actually works for people, rather than, as clinicians, we tend to make things very complicated. And I know that the CAC helps us make things much less complicated. So you've been on the committee for 10 years now. What would you say has changed during that time?
Lots of changes over the years. I think I sort of sit back and laugh, and I think to myself, if Mark Sullivan, wherever he is, if he'd have realised when he interviewed me, him and Anna, 10 years ago, that I was still going to be here 10 years ago, he probably would have said rubbish, no way known. But, it's a lot of things that have changed. I've seen, there were so many that I could remember. And things like just our changing rooms, toilets downstairs. We were involved with, getting them all up for the people. And I always tell people, and I try and say that to other places, you must have a changing places toilet in your building. Build it as you're building it. Don't worry about it afterwards, because I always say that we've got one at the dental hospital, which was one of the first ones in Australia, one of the first hospitals. And it came about because a young lad, and when I say a young lad, I think he was about 29, with a disability, he was a patient here at the hospital, and he came for regular visits to be treated, and he had to go to a disabled toilet. And it was, when you sort of think about it, for that parent to have to take that child into the toilet, all he could see when you're laying him on the floor was underneath the bowl sort of thing. It was very detrimental to that child, very hard for the parent to have to lift them up and things like that. And it made it noticeable then that it needed something really, really structured like that. And now that we're having that downstairs, It's also used for people around the area that they know that we've got one.
Yep.
And I think the AFL has got one. I think there's not a lot around, but there should be a lot more.
And I know that the team have been working with Rebecca and Tim in relation to the redesign of the ground floor and obviously the redesign of other parts of the building in the last little while to make sure that that is people friendly and consumer friendly.
Yep.
So what are you most proud of?
I think I'm most proud of probably of the changes that go through, because they're all so positive. You know, I'm actually proud that when I sit on other committees and they talk about sustainability or what does this committee need, and I said you need to go and look at the committees and the subcommittees that they've got at the dental hospital, the diversity that we've got in our CAC meeting. You know, that there's so many different people, different aspects, different nationalities, different reasons for being there. You know, and that's where other committees can actually learn from us. So I'm really proud to actually spruik about that, I suppose, to say to people, you know, we were one of the first there that started doing that. That's what you need. It's all right for people to say, are we missing people? Are we, you know, it's not a matter of saying, are we missing the older ones? Are we missing the younger ones? Are we missing male or female? It's actually a matter of saying, who else can we be having on that committee that we can have their voices for?
That's the best part about the committee, actually, is the variety of voices that we get, and so therefore the variety of opinion that we actually can take on board, which is awesome. It's actually, I'm the executive sponsor of the committee, and it's my favourite one, just so you know. What's your favourite thing about being a CAC member?
I suppose coming up here and seeing everybody. I actually said to somebody earlier, I think I was talking to Denise, and I said the funny part about it is looking in this room, there's so many people I don't know. And I've been coming here for so long, but because of COVID, I think, we haven't seen each other. But being able to talk to people online and things like that, at least that's something. But you can always talk to people. You can always, and I always say to people, go to the dental hospital. The staff there are brilliant, that sort of thing. I'll tell you a little story. One of my granddaughters 4 years ago, she actually had to come here and get 7 teeth out. Her mouth was just full of teeth and she needed them out. And at 16, she sort of thought, oh, what's this going to be like? And me being grandma and overprotective type of thing, I came with my daughter. And I was on the other side then. I was one of the parents sort of sitting there. And off she went in there. And when she came out, I sort of said, you know, what's going on? Are you all right? Are you all right? And she said, yeah, no worries, I'm fine, Grandma. And I said, what was it like? Oh, she said, Grandma, they were so lovely. She said, one of the nurses even hung onto my hand while I went to sleep. You know, and I always sort of think, you know, they go beyond, obviously above and beyond. And that was a 16-year-old that really didn't, you know, 3 or 4-year-old you can understand, but 16-year-old. But she was brilliant with it. So
what are you looking forward to this year?
I think probably more face-to-face meetings, getting to, I think, continuing the great work that we do, and lots of changes. Like we say, we go with the flow. We actually go with the different changes. Seeing Geelong win another grand final would be nice as well.
Thank you, Sandra. Thank you for sharing your experience with us. Thank you for being such an important member of our committee and mentoring some of our younger and newer members onto the committee. So thank you very much.
Thank you very much.
And I'm going to hand back to Dave.
Thanks, David.
As we've said a couple of times throughout, Sandra's been an amazing CAC representative, asset, and most of all a friend to everyone at DHSV. And when you get to 10 years at DHSV, we like to recognise you with a service award. So we would like to present you with this service award.
Thank you very much.
Just say congratulations.
Thank you. Thank you.
A bunch of flowers. Thank you very much. Sue, do you want to come in?
And the bunch of flowers just for being
You
special.
go on the other side. Okay, so thank you. Got a few more years yet, Billy. But we appreciate, again, your insight, Sandra, and how that's helping us so much as an organisation. So thank you, Sue. So this afternoon, I have the privilege of taking you through the key achievements in 2021-22. And while we're focusing on really what we've achieved, but it's also a year that I think really set us up for what we will achieve in the future. And you'll hear a little bit more from that from Sue a bit later on. So in March 22, we released our exciting new strategic Strategic direction. It's very similar to a direction and a vision. It's very good. And that vision is really bold, to create a Victoria that is disease and cavity free. And it's interesting when you talk to people about that, some may say, oh, that sounds a bit unachievable or unrealistic. But I guess we asked ourselves as a board and executive team that if we're not here to eradicate oral disease and cavities, then why are we here? That's exactly what we should be doing. And so that direction took over a year to develop up with our consumers, with our staff, with our partners, with the universities, with the department, and lots of agency input as well. And it always started with the consumer at the centre. And that's exactly what our direction is, but really integrating those principles of value-based healthcare. So a lot of you will be familiar with value-based healthcare. For those that aren't, value in health is around improving the health outcomes that matter to patients relative to the cost of care. So in other words, we want to make sure we get the right service to the right people at the right time in the right way. And that's very important for us. That informs all of our work at DHSV. Because we want to ensure that care is designed in and around the patient, that the right care is provided all the time, particularly from a prevention and intervention perspective, because we know that happens both at the individual level as well as the population level. But we want to make sure that that care is integrated. It's got to be coordinated, but it also has to be tailored to every individual person rather than one size fits all. We also want to make sure that continuous improvement is part of that work, and we're using metrics to ascertain the value of that work to ensure that most of all, the patient gets the care that they need, but we're doing it in a thoughtful way. So when you think about a life course approach, that's really important, and it might seem obvious to say, but there are problems with oral health and oral disease that are different at every stage of life. And therefore the solutions are different at every stage of life. And so therefore, with that in mind, we have three key pillars: empower, care, and lead. And I'm going to talk to you about those shortly. So as much as it's my role today to talk about the year in review, but in reality, they're not my achievements. They're the achievements of the collective. And that's an amazing team at DHSV, as well as fantastic partners that we'll reference throughout the day. But I want to use this opportunity to thank Sue McKee and the executive team, as well as all of our incredible staff, because without the relentless commitment that they have to improving the oral health of all Victorians, we wouldn't be able to achieve the significant advances that we've made this year. So I just want to say thank you very much. So the Empower pillar focuses on prevention and early intervention and how we can support people to look after their oral health proactively at home. So it's far more important that we can do that at home rather than them coming into RDHM or the agencies. But therefore, we have to do it with great partners. So we've worked with health, education, childhood sectors, families. We work with a lot of people to make sure that eat well, drink well, clean well, very simple message, is embraced for people throughout their stages of life. Very pleased to say our Smiles for Miles program reached more than 56,000 preschool aged children. And we celebrated 10 years of healthy families, healthy smiles. And that program has trained over 534 professionals in how to support pregnant women and young children to achieve good oral health. So the work we're doing preventatively to make sure that we can work with mothers before they even have their children, will know that that will improve the oral health of their children. And so those professionals include maternal and child healthcare nurses, midwives, dietitians, oral health professionals, playgroup facilitators, and believe it or not, even librarians, because of the role that they play. So as that cost of living continued to rise, we also supported over our community with over 100,000 of these oral healthcare packs that have come through our Smile Squad program with thanks to the Victorian Government. And again, this is a great opportunity to help with that proactive messaging to not only make sure that we can support people before they need that oral health care, but also in terms of that eat well, drink well, clean well message. So from an oral health promotion team also had a fantastic year, and some of the highlights included the Deadly Tooth Tips series. There's a great image up here as well that, again, developed by an Aboriginal artist, Madison Connors, and just is a great way to integrate the importance of those messages in a really easy to understand way. We also did a toothbrushing with young children video series, and I can give you a first-hand experience that my kids absolutely love that. So it's helped at night. But we continue to train the next generation of oral health professionals in a range of preventative techniques via our annual Innovations Conference. And there's a dental assistance conference, there's CPD days, there's training courses, and it included training 12 Aboriginal health practitioners in the application of fluoride varnish. So again, we're being very proactive in our important communities. So our second pillar is care, which focuses on providing world-class oral and dental care. It's about ensuring our care is built around those value-based healthcare principles that I mentioned earlier, and we make sure it's evidence-based, improves health outcomes, and is certainly proactively, particularly for our children. Now, it was really difficult during the year of 2021 to 22 to deliver the level of care that we'd like to, given the COVID challenges. But we still were able to treat 290,000 Victorians. And that included 11,602 Aboriginal people and 9,500 refugees and people seeking asylum. Now, that was for the financial year that we're talking about today. If you looked at the calendar year that runs from January to December, we've already increased that number to over 322,000. So we'll continue to increase that activity to make sure we can get to more people in our community. So despite the COVID-related disruptions, Smile Squad, which again you'll hear us talk about a lot today, that provided care to over 20,000 students. And that's across 228 schools. So even with the challenges through COVID, we're really proud of that number. And then again, that increased significantly if you look at the calendar year, from 20,000 to 42,000 over the course of the calendar year. So we're very excited. We thank the Victorian Government for their incredible support, and we know that they're making oral health care more accessible and affordable through the Smile Squad. So we thank the Minister, the Department, and everyone who's been passionate about Smile Squad as much as we are. We've also had some fantastic funding support from the Department of Health that allowed us to address deferred care challenges that were arisen through the pandemic. So we used an oral health questionnaire, which is again part of that value-based healthcare model, to identify the most people who are in need. And we offered them additional support and appointments. And as a result, we were able to increase the activity of over 91,000 people through that program. So we had significant reduction in that wait list, and we're still not where we wanted to be, but we've made significant improvement there, which we're very proud about. Another highlight was the development of the adult oral health service delivery model, which is really difficult to say when you're trying to say a lot of other things, but the new model aims to improve the health outcomes of our adult patients and reduce the wait list for care. It helps us prioritise those who are most in need. Again, that questionnaire is very important, with many more preventative opportunities to help improve that care. And to enable the consistency of patient information, we've progressed the project to move to a single electronic oral health record. And we actually just had a board meeting before this and got a further update from Nuno and the team. But we've also now digitised over 33,000 patient records. So that's across the state, and that allows us to have a more consistent model of care and to measure the outcomes from that patient experience. So our third pillar is one that, frankly, as a leadership team, we're the most excited about, and that's about LEAD, because that really is improving the oral health across the entire system, so not just the HSV. And to do that, we partner with many of our fantastic partners that, again, are here today, because we know that we can't do that completely on our own. So we're happy to be in the driver's seat, but we want to make sure there's lots of other people on the bus that we're working very hard with. And so this pillar relies on those partnerships, which is absolutely critical, and we thank everybody for those. But in order to lead, we need to raise the profile of our organisation at a national and an international level. And it was really refreshing to be recognised as a leader in value-based healthcare. And we were actually able to win the prestigious International Value-Based Healthcare Prize in May 2022. This award recognises the innovative nature of our approach and its capacity to reduce the overwhelming burden of oral disease. We're also able to present at a conference in Boston run by the International Consortium of Health Outcome Measures and join two influential groups, the Value-Based Healthcare Europe Group and the Global Centre for Person-Centred Value-Based Healthcare Innovation Hub. There's a bit to get through there. But I'd like to also recognise and thank our Professor Zoe Weiner. She's unable to make it today, but she's not only the Deputy Secretary of Public Health, but she was a previous DHSV board chair, and she was really one of the architects of driving this big focus on value-based healthcare. So I wanted to acknowledge her and thank her for her support. So we continue to strengthen our partnerships with community dental agencies, those 53 that we have across the state, in rolling out innovation grants, hosting regional forums and working with the clinics to roll out Smile Squad and particularly to manage the wait lists. Workforce shortages continue to put our dental clinics under pressure, so we developed a new statewide workforce strategy, which Sue's going to take you through a little later on. So one of my favourite achievements of the year was the partnership that we had with the Department of Health around a Jobs Victoria program that was able to offer 100 job seekers into dental assistant trainee roles. We've actually got a few of them here today, so we're excited to have you along and already made a fantastic start. And it's pretty amazing too, because you see the talent that's on offer through these people. And you think about those great 100 new DAs and what they'll be able to do in the next wave, it's really encouraging. And I hope that one day they'll be up here giving this presentation, and hopefully a lot better than I will. But like many other healthcare organisations, we employ more women than men. And a large number of those women are in lower paying roles. And so while we provide equal pay for equal work, we do have a gender equity pay gap. And I'm not happy with it, the board are not happy with it, Sue's not happy with it, our whole business is not happy with it. So I wanted to acknowledge that clearly and upfront. And so we are committed to closing that gap and eradicating that gap. It's absolutely critical. So our Gender Equity Action Plan was developed to close this gap and create a strong pipeline of women leaders in key roles and many more initiatives. We launched the program or the plan in June 2022 after extensive consultation with our staff, with our partners, with the universities, with the executive, with the board, etc. And the plan focuses on promoting and supporting gender equality at all levels. It focuses on refreshing our approach to recruitment, development, and importantly, remuneration. Developing policies and procedures that support people's lived experiences and cultivating an inclusive and safe working environment. I really encourage you to read the plan. I think it's a strong plan, but we need to do better and we will do better. And really encourage you to read that and love to hear any other feedback and thoughts there. So it's a quick overview of the highlights for the year. And if you'd like to read about those initiatives in more detail or review our financials, there's hard copies of the annual report that are here, but we'd always encourage you to look online so that we can reduce our footprint from an environmental perspective. So I'd like to conclude just with a few more thank yous. Everything we achieve is in collaboration with our key partners. Very rarely do we do things purely on our own. We work with fantastic partners. So I'd like to thank the Minister of Health, the Honourable Mary Ann Thomas. I had a bit of time with her last week, and her energy and passion for health, and particularly for oral health, is infectious, and we really appreciate her support. Special thanks to all of our partners at the department as well. Our community dental agencies, who do the majority of activity, are also fantastic partners. The universities, the oral health champions across all parts of the health ecosystem. Our early childhood diversity and cultural partners as well. Thank you for your continued support and your investment towards our vision. In June, we farewelled Professor Jane Gunn, who concluded her term as DHSV Board Director, and we thank Jane for the pivotal role she played at DHSV over the last 3 years. In particular, she was such a champion of the Population Health Committee and did a fantastic job there. We pleasingly reappointed Sue Banks and John Gavins as well for further terms. We also welcomed Candice Charles for her first term on the board, and she's brought an incredible amount of experience in governance and already made such a great contribution to the team. I'd also like to thank my fellow board members for all of their fantastic contributions, expertise, counsel, support. It's an absolute pleasure to work with each of you, so thank you very much. But I always prefer to look out the windscreen rather than in the rearview mirror, and so the more exciting part about the year in review is actually the year ahead. So with that, I'd like to introduce Sue McKee, to our fantastic CEO, and who's going to talk about the future, and we can't wait for it. Thank you very much, Sue.
So good afternoon, everybody. As Dave mentioned, we have a very bold strategic direction to create a Victoria that is disease and cavity free. To achieve this vision, we actually need to ensure that we are delivering the world's best oral and dental health care. And in order to do that, we need to build a learning organisation that researches and implements world-leading practice. Our strategic direction is supported by an annual business plan that keeps us accountable and on course. And Tim's nodding in the background over there. This afternoon, I'd like to talk to you about some of the major activities and projects that we're working on to turn our vision into reality. I'm sure as you walked through the gates this afternoon, you would have seen our Smile Squad vans out the front. If anybody would like to have a tour through those after this meeting, they'll be set up in Lynch Street, and we've got some of our amazing Smile Squad team here to actually take you through those if you would like. The Smile Squad is a major commitment from government to provide free oral health care to Victorian public primary and secondary schools. By taking this government-funded care to the school, we can ensure that families save time and money. We bring care closer to home to stop families having to travel, and we will set our kids up for a lifetime of good oral health. Our community dental agencies play the pivotal role in delivering these services to the schools. We will continue to work with our agencies and support them to roll out the program and increase the number of schools participating in the program and the number of children under care. The program is focused on the prevention of oral disease and cavities. The distribution of dental packs, as Dave has shown you before, ensures that every student is able to have an oral health pack which has a toothbrush and toothpaste and some instructions. It's really important that that eat well, drink well, clean well message is getting out there. And it ensures that not having a toothbrush or toothpaste is no longer a barrier for our school children. So it's important, as the cost of living increases, that we're actually supporting that piece. An extension of the Smile Squad program is the government commitment to increase access to specialised services closer to home to ensure those children who need specialised care have easy access. We're in the process of setting up, establishing specialised hubs across the state, one in Bendigo, one in Geelong and one in the Latrobe Valley. Obviously, the Royal Dental Hospital of Melbourne will continue to provide those specialised services for children in the metro area. The services will include paediatric dentistry, oral surgery and treatment for children with special needs. This means children in regional areas will no longer have to travel to Melbourne to receive those services. Children can be referred to the hubs through the Smile Squad, and kids in the metro region, as I said, can access care at the Royal Dental Hospital of Melbourne. To enable this service to get up and running quickly and as soon as possible see those children that are on the wait list, we also have engaged some private providers to assist us get that coverage across the state. Our second big priority is managing the wait list. As Dave spoke earlier, we've had a significant increase through 2020, 21 and into 22 as we've had services restricted. We haven't been able to see all the people that we would normally see in that time. Not just about COVID restrictions and not being able to do certain activities, but unfortunately our workforce is not immune to disease and they have actually also had increased sick leave. So it's restricted the ability to service a lot of our patients. Our patients also have had a lot of sickness, so have not turned up for their appointments. but also some have been quite cautious, which is understandable, not wanting to come and sit in waiting rooms. So our ability to actually see community has been quite restricted. Thanks to some increased funding from the state government, we've been working with our agency partners and the private sector to see as many people as possible to reduce the wait list and the wait times. In 2021-22, we targeted 137,000 people who'd been waiting the longest for care. The total reduction of that wait list is over 98,500 people. We almost cracked the 100,000, but not quite. So we were looking at those people who had been waiting the longest. We're now targeting all the remaining people on the general and denture and priority denture waiting list. This equates to about 70,000 people at the minute. We utilised the opportunity to test our new value-based service delivery model. Using an oral health questionnaire, we're able to understand people's risk profile and measure outcomes that matter to the patient. Over 35,000 people have completed the questionnaire, enabling us to or providing us with a rich source of data and to support patients with targeted education and clinical care. Obviously, we can't do any of this without a workforce. So we have been working over the last several months about building a workforce strategy. Oral health, like other parts of the health sector and wider workforce, have not been immune to workforce challenges. We have a greater issue as we need to build a larger workforce to deliver the Smile Squad, to deliver specialised services and to deliver some of our major projects like the electronic oral health record. As of October 2022, the chairside vacancy gap across the state equated to about 300 FTE, so we have a significant challenge. Activity targets are being met, supported by issuing of vouchers for private care, but we need to build a sustainable workforce going forward. We've done an extensive consultation with our stakeholders to understand the challenges and identify the solutions. We have a new strategy which is focused on accelerating the attraction and retention of oral health workers, prioritising employee experience and professional development, and partnering to build a better oral health workforce. The strategy defines both short, medium and longer term actions for us to focus on. Some of the key actions over the next 2 years include a future workforce. So we've developed new clinical placement opportunities for our undergraduate dentists and oral health therapists into Smile Squad and other settings. We've had extremely positive feedback from our OHTs who've been out in Smile Squad. They absolutely love it. We've commenced a graduate training program at the Royal Dental Hospital of Melbourne for recently graduated dentists, with a plan to expand that to OHTs in the middle of the year. As Dave has already alluded to, in collaboration with Jobs Victoria, we've commenced a dental assistant traineeship program to support the training of over 100 dental assistants in the coming 18 months. We think we'll actually get to that target much faster than 18 months. Some of our first cohort, as we've said, are already here today, so it's great to see them. Obviously, making sure that we're continuing to provide exceptional services at the Royal Dental Hospital of Melbourne, we've commenced a program that we're affectionately calling Operation Lighthouse. We would like the Royal Dental Hospital of Melbourne to be the beacon on the hill, to be the leading teaching and training environment and the centre of excellence for oral health care. The program focuses on 4 areas. Operational excellence, which focuses on getting the foundations right and ensuring we can see as many patients as possible whilst providing amazing care. Focusing on workforce, to build a sustainable workforce for now and planning for the future, aligning with our workforce strategy. Service planning and models of care will focus on designing and implementing models of care to meet current and future demand and implementing those principles of value-based healthcare that we've talked about. Obviously, partnering with our universities will focus on strengthening the relationship with the universities to deliver high-quality teaching outcomes. We've already talked about this a little bit. Diversity and inclusion, a really important part of how we build a workforce that mirrors the community that we serve. So we are working very closely on delivering our diversity and inclusion plan. We have set up a new inclusion committee this year to actually look at how we can make sure that our organisation is safe for all. We're also working, as Dave has already said, around our gender equity action plan and making sure that we are trying to reduce that 30% gap in pay that we currently have in our organisation, how we can actually build a strong pipeline of female leaders. We've set up a Women in Leadership Scholarship that we apply every year. I think last year we handed out about 7 of those. We also have a CEO scholarship to help build people's clinical skills as well. We're continuing to work on our reconciliation to ensure our workplace is culturally safe. We need to develop our second plan to guide our activities for the next 3 years. There'll be significant work for us to do in our organisation to ensure our people understand the importance of reconciliation and the importance of making a culturally safe organisation. We are continuing to create a pipeline of women in leadership roles, as I said, with our Women in Leadership scholarships, but also making sure that we have a workplace that is inclusive for all. We've talked a little bit about value-based healthcare. We've been on this journey to implement the principles of value-based healthcare to transform the way we deliver care for the last 5 years. Knowing that most oral disease is preventable, we're shifting the focus of our service delivery to prevention and early intervention. Our Smile Squad delivery model is prevention focused with our key messages and oral health packs. Early interventions of fissure sealants and fluoride varnish in the Smile Squad program will support the prevention of cavities in our kids. We will continue to implement value-based healthcare through Smile Squad, specialised services and the new adult service delivery model that Dave spoke about earlier. We'll continue to build our international profile through our work with the World Economic Forum, partnering with ITOM and the Global Centre for Person-Centred Value-Based Healthcare. We've also in recent times developed a funding model that will incentivise prevention and pay for health outcomes that we plan on testing in the coming financial years. This will be a game changer for oral health and the broader health community. Changing funding models is always difficult, however, we need to start. We're looking at shadow funding over the coming financial years to provide us with the evidence and to test the theory behind our model. We need to ensure that the outcomes that we are trying to achieve and incentivise are real and that we understand the new drivers and behaviours that it creates when we revise and adjust a funding model. We continue to work with our partners to raise the profile of oral health to try and get the mouth back in the body. If that's not enough, one more thing that we're doing is our oral health record, our electronic oral health record. This is the last enabler that I'll talk about, but by no means the least. Many of you, clinicians in this room, would say, but Sue, we already have an electronic oral health record, and that's true. However, what we do have is over 50 instances of a very old legacy system that does not integrate with other systems and is not visible from one clinic to another. And it's unable to identify if the Mrs. Jones at Mary Health is the same Mrs. Jones at Barwon. We're into the second year of a 3-year project, which will see a lot of groundwork, building new systems, working with our clinicians to ensure the processes and flows are right, and lots of testing to make sure we get it right when we go live. The new system will enable us to collect meaningful data that supports patient-centred care and efficient practice while removing variability of our service. I would also like to echo Dave's sentiments and say thank you to everyone who is working with us to create a Victoria that is disease and cavity-free. Thank you so much to all of our partners who are the ones who actually enable us to do this work, but also thanks to the team that have been putting today together. It's been a lot of work to get to this point, and I hope you will all join us downstairs. But before we do that, we're actually going to start handing out some of our service awards to a few people who are in the room. But before I do that, has anybody got any questions for me? And remember, you didn't ask him any, just so you know. So it's now time for our service awards. Today we're going to recognise people who have made a great individual commitment and contribution to public health. At DHSV we are honoured to call some of the best people, colleagues and friends who dedicate their lives to public health. This is just about to get really hard. So for those who don't know, Sajeev Koshi passed away earlier this week. He represents everything that public oral health care is about. He strongly believed that the state of one's bank account should not have any bearing on the quality of the care that they receive. He was a vocal advocate for universal dental care and strived to improve access to oral health services for children, regional communities, survivors of torture, Aboriginal people and those affected by bushfires. There is so much more I could say about him, but I'm going to leave it there. It would have been Koshi's 20th year with us this year. Okay, so let's move on to more nice things. So we have lots of people who get recognised in our organisation from 5 years, 10 years, 15 years, 20 years, 25. I've even handed an award a few years ago to somebody who had been here for 50 years. Jennifer, you could probably see her around. She works in our teaching clinic. She's a fantastic patient liaison. So these are 5 people who have reached 5 years. They are not in the room, but we wanted to recognise them anyway. We also have people who have been here. Oh, you are here. Oh, okay, hang on a minute. Hold the bus. These are people who have been in our organisation for 10 and 15 years. Again, an amazing contribution to providing public dental care and public oral health care. And as you can see, not necessarily all clinicians. And we have a couple of people who've been here for 20 years and 25 years, which is amazing. We couldn't convince them to come up on stage. Some of the people are a little bit shy. So now we're actually going to hand out some awards to people who are in the room. So I'm going to ask Dave to come. He's going to come and hand things out, and I'm going to talk about some of the people who we're going to honour tonight. So our first award goes to Susanna, who has been with us for 5 years. Susanna is our health and safety consultant, an important role that helps us identify, assess.
Congratulations.
Thank you so much for it. Really amazing. Thank you.
And control hazards. Susanna loves that she gets to look out for her teammates and everyone in the building. She's a gold level ballroom dancer, just as an aside, and says her favourite dance of all time is the Viennese waltz. I'm sure if you ask Susie nicely, she will teach you a few steps over canapes a little bit later on. Thanks, Suze. Our next person, I'd like to invite Walissa up to the stage. Walissa D'Souza.
Thank you. Congratulations. Thank you for everything you do.
Walissa is a research assistant in our health informatics department and says she loves all the people she works with, the projects she's involved in. She says everyone is knowledgeable in different disciplines and there is always an opportunity to learn. That's what she likes. That's what we like to hear. Walissa grew up in Abu Dhabi, where she learned Arabic and enjoys reciting poetry in Arabic. Can't wait to hear some of that later as well. Over the years, she's lost touch with many of the languages, but is taking steps now to learn it again. Thank you, Walissa, for your work. The next 5-year award goes to, oh sorry, I need to click through, don't I? Wayne Chow. Oh, he's an apology. Oh, well, I'm going to talk about him anyway. Wayne is our head of integrated specialist care. Wayne says he finds it very rewarding working in public dental. He loves chatting with his colleagues over coffee, even if it's just for a quick hello. Wayne always catches the early worm because he can't sleep past 6 a.m, even on weekends. Crazy. Second last, Martin Hall. Dr. Hall, come on up.
Congratulations.
It feels kind of strange recognising Martin for 5 years of service because he's actually been in the public oral health sector for much, much longer than that. Martin says he loves his boss. Thanks, Martin. And enjoys working alongside a team who have such integrity and commitment to improving public oral health. During the COVID lockdowns, Martin became an avid fermenter and started making his own beer and kimchi and gin, just so you know. Needless to say, he's got good gut health because of that. Thanks, Martin, for all of your work. Thank you. The last person we'd like to recognise who isn't here as well because she had a minor accident and has sprained her ankle so couldn't make it in this afternoon is Vicky Barr. Vicky's been with us for 20 years now. And we'll make sure that she actually gets her award, but congratulations on a fantastic milestone of Vicky. I'm going to hand the mic, well I don't need to hand the mic, but I'm going to hand back to Dave to wrap up afternoon session, and thank you everybody for your attention.
Great, so thank you very much, Sue, and congratulations to all of those award winners and fantastic service. We appreciate it. So with that, I would like to officially close the 28th Annual General Meeting of Dental Health Services Victoria. Thank you all very much for coming along. Thanks to those who tuned in. We really appreciate your support and we're very excited about the year ahead. So we'd like to invite you to come and have drinks and canapes downstairs on the ground level, a little outside area. We'll take you there, but hopefully we'll get a chance to spend a bit of time with you. Thank you, and we look forward to a great year ahead. Take care.